The first group of bones in the axial skeleton we'll discuss are the bones of the vertebral column. We'll use the following images to show the different segments of the vertebral column: a lateral view and an anterior view. Beginning with the articulation of the occipital bone of the skull is the cervical region, and there are 7 cervical vertebrae. The next region is the thoracic region, which covers the majority of the back. There are 12 thoracic vertebrae. In the small of the back, there are 5 lumbar vertebrae in the lumbar region of the spinal column. Next is 5 fused sacral vertebrae and the coccygeal section of the vertebral column. These images depict the anatomy of a typical vertebra. The image on the left is a superior view, and the image on the right is a lateral view. The vertebral body is the thick anterior portion. This leads to a vertebral arch and the transverse processes. The spinous process is at the dorsal or posterior end of the vertebra. Vertebrae also have articular facets which articulate with the vertebra above and below. The vertebral body is in contact with the intervertebral discs, and this transfers the weight along the axis and length of the spinal column. The vertebral arch protects a portion of the spinal cord, and from it extend the spinous process and the transverse processes. These processes function by providing muscle attachment points, as well as by playing a role in the articulation with rib bones. The spinal cord passes through the vertebral foramen in each vertebrae. Let's look at each segment of the spinal column, beginning with the cervical region. The cervical vertebrae are the smallest in the spinal column. These are located between the occipital bone at the base of the skull and the first thoracic vertebra. The vertebrae C2 through C6 are very similar in shape, whereas C7 resembles the thoracic vertebrae. It's in the interface between the anterior or convex cervical curve and the posterior or concave curve of the thoracic vertebrae. A large ligament known as the ligamentum nuchae begins at C7 and extends cranially to the external occipital crest on the occipital bone of the skull. The cervical vertebrae support the weight of the head, and in their vertebral foramen pass the nerves that connect the brain with the rest of the body. The cervical vertebrae facilitate wide range of movements of both the head and the neck. The cervical region of the spinal column. The cervical region of the spinal column contains 2 unique vertebrae. The first cervical vertebrae, known as the atlas, C1, and the second cervical vertebrae, known as the axis, C2. The occipital bone of the skull rests on and communicates with the first cervical vertebrae, and the arrangement of these first 2 vertebrae allow for a wide rotation of the head on the spinal column. The atlas, C1, articulates with the occipital bone of the skull. This vertebrae lacks a vertebral body. It has oval articular facets and has the largest vertebral foramen. The axis, C2, contains what's called a dens or odontoid projection, and this is from the fusion of the first 2 cervical vertebrae. The dens projection passes through a ligament opening in the atlas, which permits the skull to pivot relative to the rest of the spinal column. This fusion between C1 and C2 is not complete in children, and therefore severe shaking of a child can lead to dislocation and subsequent brain damage. The next region of the spinal cord we'll discuss is the thoracic region. There are 12 thoracic vertebrae, named T1 through T12. The thoracic vertebrae support the weight of the head as well as the weight of the neck and upper limbs. These vertebrae articulate with rib bones, and along with the sternum, they stabilize the rib cage. The thoracic region of the spinal column forms a posterior or concave curve. The vertebral body of the thoracic vertebrae is larger than the cervical region. The dorsolateral surface of the vertebral body articulates with the rib bone. Vertebrae T1 to T8 have superior and inferior costal facets as they articulate with two pairs of rib bones. T9 to T12 have a single facet on each side. The next segment is the lumbar region of the spinal column. There are 5 lumbar vertebrae named L1 through L5. These vertebrae have the largest vertebral body but the smallest vertebral foramen. Lumbar vertebrae form an anterior or lordotic curve and are located in the small of the back and bear the most weight in the vertebral column. These vertebrae provide attachment points for lower back muscles. And the true spinal cord ends at the second lumbar vertebrae in 98% of the human population. As shown in this image, the transverse processes are smaller and project laterally, while the spinous process of a lumbar vertebrae is massive. The lumbar vertebrae do not articulate with other bones on their vertebral bodies, but they do have superior and inferior articular surfaces. The vertebrae in the lumbar region are the most frequent site of dislocation and rupture of the intervertebral discs. Moving in a caudal direction down the spinal column, the next segment is the sacrum. The sacrum is made up of 5 fused sacral vertebrae, which usually occurs by the age of 30. The sacrum functions to protect the organs of the reproductive, digestive, and excretory systems. Also, the sacrum attaches the axial skeleton to the appendicular skeleton through the pelvic girdle through articulations. The sacrum is curved and the curve is more prominent in females. The sacrum transfers body weight from the upper regions of the body and the axial skeleton and transmits the weight to the pelvic girdle and the appendicular skeleton. These images depict the surfaces of the sacrum. First, the anterior surface. At the lumbar end of the sacrum is the base. At the opposite end is the apex, which articulates with the coccyx. On the anterior surface there's a pelvic surface as well as sacral foramina. The posterior surface has the entrance to the sacral canal as well as the articular processes. There's a median sacral crest and a sacral hiatus. The sacrum articulates with the 5th lumbar vertebrae at the superior articular processes. The sacral canal runs the length of the sacrum from the superior articular processes to the sacral hiatus region. And this canal is a passageway for the nerves and membranes that travel caudally through the vertebral canal. The sacral hiatus is the end of the sacral canal, and the sacral foramina transmit a division of sacral nerves. The last segment of the spinal column is the coccyx. The coccyx is made up of between 3 and 5 coccygeal vertebrae that are commonly fused by the age of 28. The coccygeal cornua is where the lamina of the first coccygeal vertebrae meets the cornua of the sacrum. The sacral coccygeal symphysis, which is a joint, permits a little movement between the sacrum and the coccyx. Tendons, ligaments, and pelvic muscles are attached to both the anterior and posterior surfaces of the coccyx. The following is a clinical note on kyphosis and lordosis. Kyphosis and lordosis result from conditions that damage the bones and muscles associated with the vertebral column. In the case of lordosis, an anterior exaggeration of the lumbar spine curvature leads to the protrusion of the abdomen and buttocks. Kyphosis is the abnormal exaggeration of the thoracic curvature and leads to the rounded back appearance. Kyphosis can be caused by osteoporosis and compression fractures and abnormal vertebral growth.